Welcome. My name is Peter Strong. I'm a professional psychotherapist based in Boulder, Colorado, but I offer online therapy via Skype worldwide. I see people throughout the USA, but also in the UK and Western Europe and as far away as Australia. People come to me because they're looking for a different way of working with anxiety or depression. A different approach that doesn't involve using medications or endless sessions of just talking about your emotions and your family history and so on. These conventional approaches that are what are most widely available for treating anxiety and depression don't seem to work particularly well for most people. Medications may produce a short relief from symptoms, but medications will never change the underlying psychological process that's causing your anxiety or depression. And the same for conventional counseling or talk therapy. Generally, just talking about your emotions is not sufficient to change these underlying powerful habits that create your anxiety or depression. You need more than just talking about them. You need to explore the mechanism of how your mind works, how it actually creates anxiety or depression. And that's the approach that we take in mindfulness therapy, which is what I specialize in and have worked on over many years now and find to be most effective. My clients really enjoy the mindfulness approach for healing because it gives you practical and very effective tools for overcoming anxiety and depression, for healing anxiety and depression, not just coping with it. If you're interested in learning more about mindfulness therapy, then go to my website and read more pages and watch more videos there. And of course, email me anytime with any questions you may have about the mindfulness therapy approach. So I offer online therapy via Skype. I really enjoy working with people over Skype because it's basically is just as good as working in person if you can see each other, but it means that I can work with people all over the world. All you need is a good internet connection. So I find that very appealing myself. It's also, of course, very convenient for you to work with an online therapist over Skype. Being able to see a Skype therapist means you don't have to leave home. And if you're suffering from anxiety or depression or addiction, often it's difficult to leave home, and it's often difficult to go and meet a therapist in their office. It's too intimidating. So the added convenience and comfort of being able to talk to a therapist like myself from your own home is a very important factor, and it actually improves the effectiveness of your psychotherapy sessions. It's really important. You should not really depend on treatment-based therapies, whatever they are. Certainly not medications. But treatment-based approaches are not really empowering you. They are reinforcing the sense of being a victim that has to go to someone else to get their problems solved. And that's not my approach. I don't believe in that approach. What I believe in is giving you the tools to work on your emotions yourself so that you can heal inside. You can heal past trauma, which is often the starting place for anxiety and depression. It's about empowering you. That's the whole focus of mindfulness therapy. We work on emotions by bringing mindfulness to them. We learn how to form a different kind of relationship with our painful emotions that's not based on fear, that's not based on avoidance, that's not based on hatred, but is based on compassion. It's about learning how to develop a compassionate and conscious relationship with your anxiety or depression or any other emotion. This is central to mindfulness therapy. It's what really makes the difference. And just talking about your emotions is not the same as developing a conscious and compassionate relationship. Typically, that is more of a process of being silent in relationship. The same way that you would comfort a child that was in pain. You don't just talk to the child endlessly about their emotions and trying to convince them not to feel afraid if they're feeling fear, or not to be angry if they're feeling anger. Talking like that is not really very effective. And it's the same with our emotions. Just talking at them or trying to talk yourself out of feeling those emotions is not really a very effective approach. What is effective is to learn to embrace those feelings with a great deal of compassion and acceptance, in addition to the other important quality of mindfulness, which is investigation, which means curiosity. How does it work? In the case of emotions, the emotions are fed by reactive thoughts. So the first part of mindfulness therapy is learning to see all these reactive thoughts. That's part of the underlying habitual process that causes your anxiety and depression, and that is not touched by medications. We get to see these thoughts in great detail, and then as we become more conscious, we can begin to change our relationship to those thoughts so that we gain more power, and we can begin to reverse the habit of becoming identified with those thoughts and becoming imprisoned by the thoughts and beliefs that feed our anxiety or depression. That's really very important. The first part of mindfulness therapy is learning how to relate to thoughts. When you can change that, then you stop feeding the emotions that are in pain. And then the second part is bringing this compassionate relationship to the emotion itself and exploring how you can comfort that emotion, seeing it very much like as if it was an inner child or a small animal, or any case something that you can relate to that's in pain. How would you comfort it? You already know how to do that. That's part of your true nature, your true self. You know how to be compassionate and how to care for a child or an animal that's in pain. We need to apply this to our own emotions. And this is very much a focus in mindfulness therapy. So if you'd like to get started with me, you like the idea of working with a Skype therapist, then please contact me and let's schedule a Skype therapy session at a time that works for you. And we can begin to explore how to apply mindfulness to produce effective and fast healing of your anxiety or depression or your addiction. Addiction is what we call a behavioral reaction to an unresolved emotion, generally some form of depression. That's the most common core emotion behind addiction. So if you want to get started with some online therapy sessions with me, then please contact me now. Thank you.